Welcome to the Defeating Epilepsy Foundation YouTube channel. In this presentation, we will discuss what the CDKL5 gene is, the CDKL5 protein, CDKL5 disorder, its history, diagnosis, signs, and symptoms, as well as treatment options. Make sure to like our videos and subscribe to our YouTube channel. Click on the bell to be notified of future videos. Please click on our donate link in the description section below and donate today. Your donation helps us to make a difference for those battling epilepsy. We appreciate your support. The CDKL5 gene is the most active in the brain and codes for a protein found in cells and body tissues. The CDKL5 gene is essential for normal brain development and functioning. The protein that is produced by the gene has 5 different versions. Studies have shown that the CDKL5 protein is involved in the formation, growth, and movement of nerve cells and cell division. The CDKL5 protein acts as an enzyme. It changes the activity of other proteins by adding clusters of oxygen and phosphorus to specific positions. It may also target the MECP2 gene, which is responsible for the function of neurons and brain cells. There are many mutations associated with CDKL5 that result in a CDKL5 deficiency. Seizures and affected cognitive development characterize this deficiency. Affected individuals have severe learning disabilities and cannot live independently. This condition is most common in women. Mutations in the CDKL5 gene are generally caused by changes to single protein blocks. This mutation is most common in the kinase domain of the protein and restricts the addition of phosphate groups to other proteins. Other CDKL5 mutations alter different regions of the protein and result in a nonsense mutation, creating an abnormally short protein. This mutation tends to be less severe than the deficiency and SMP mutation. The exact protein targeted by the CDKL5 protein has yet to be determined. However, it is known that CDD is an X-linked dominant disorder. X-linked dominant conditions occur mostly in females since the disorder is tied to the X chromosome. Although predominantly affecting women with a ratio of 4:1, males with a CDKL5 gene mutation are more severely affected. Most of the CDKL5 gene mutations occur spontaneously and are not tied through genetics. However, in some extreme cases, there have been multiple generations of CDD. Diagnosis is based on symptoms, medical history, and a physical exam. Evaluations can include neurogenics, genetic counseling, gastroenterology, rehabilitation medicine, orthopedists, pulmonology, cardiology, ophthalmology, gynecology, and physiotherapy. Molecular genetic testing confirms the diagnosis through genetic sequencing of the DNA. The mutation must also be considered disease-causing in accordance with recognized guidelines for assessing pathogenicity. Seizures are the most common symptom and are usually difficult to control with medication. Infantile spasms, myoclonic seizures, and tonic-clonic seizures are some of the seizures that people with CDKL5 experience. Basic tasks are affected, such as motor skills, the ability to pick up small objects, and cortical visual impairments. Individuals may also have severe intellectual disability and little or no speech. Main symptoms include seizures, epileptic spasms, limited hand skills, purposeless hand movements, teeth grinding, and poor muscle tone. Other symptoms include breathing irregularities, respiratory infections, scoliosis, behavioral symptoms, anxiety, and social avoidance. Patients usually undergo physical therapy, occupational therapy, speech therapy, and augmentative communication therapy. Physiotherapy/physical therapy helps to improve muscle tone, muscle strengthening, balance, prevention of foot deformities, and maintenance of foot alignment. Psychosocial support, genetic counseling, and dietary therapy such as a ketogenic diet are other options for treatment. If the ketogenic diet is used as a treatment option, it must be monitored under close medical supervision. In 2022, Ganaxolone was approved to control seizures in patients 2 years of age and older. Ganaxolone is the first treatment to be approved for CDKL5 disorder. In conclusion, a mutation to the CDKL5 gene is a condition that can severely inhibit one's life. The condition is confirmed through genetic testing and usually leads to an inhibited lifestyle with restraints in education, communication, and movement. There are many treatments to minimize the effects of CDD, but there is no affirmative cure. Be sure to consult your doctor to choose the right care pathway. To learn more about CDKL5 and epilepsy, please check out the resources used in the presentation today. Please like and subscribe to our YouTube channel and follow us on our social media pages. We would love to hear from you. Leave a comment below or email us at info@defeatingepilepsy.org. Thank you for your support, and together we will defeat epilepsy. Check out our other great videos and subscribe today. You have the power to defeat epilepsy.